On a voyage of discovery across the open sea, we meet a band of pirates in search for the dead man's chest. Sorry, the sick man's chest, and the reasons behind his latest heart problems. It all began when the simplest of tasks became brutally exhausting. Episodes of fainting, falling, and passing out were no longer limited to a nightly consumption of rum, and something had to be done. Navigating the starry midnight sky, fate had led our captain to an expert cardiologist, Dr. Calypso, who would reveal the unknown.
What exactly did he put into the chest?
Yamai. Upon examination, she noted a strange decrescendo murmur on the left sternal border of his chest during diastole that sounded like this. S1 is the closing of the mitral and tricuspid valve, and S2 is the closing of the aortic and pulmonic valve in diastole. She didn't have to throw the bones or contact Mike, the witch doctor, to know that this murmur was a telltale sign of blood leaking past the aortic valve and back into the left ventricle. But even a witch doctor knows her magic can't compete with an echocardiogram. So she summoned from the dead the best echo tech at Delray Beach to confirm her diagnosis of aortic insufficiency. You're about to witness his discoveries. Starting the journey into the heart, we first look at the peristernal long axis of the aorta. Now our pirate has a large heart, and it's not due to how kind he is to his winches, rather left ventricular enlargement. Color Doppler here reveals a multicolor regurgitant jet in diastole. The valvular opening, known as the vena contracta, is showing a moderate level at 0.34. In M mode, we can see the diastolic flutter of the aortic valve cusp. Moving on to the short axis of the base of the heart, it's here where we can count all three cusps of the valve and rule out any congenital defects like bicuspid aortic valve or fused cusp. Placing color on the valve will also confirm our regurgitation. Next is the 5-chamber view showing antegrade flow during diastole. Our 3-chamber view showing antegrade flow again. Measure pressure, half-time, and continuous wave. Severe AI will have a steep slope and bright echoes that show the intensity, whereas a less severe will look like our captain's AI, which has a flatter and broad top with white echoes. Looking down the suprasternal notch, we can see normal flow in blue, going down a descending aorta, but also regurgitant coming back in red, pulse width confirms. Placing color flow in M mode allows you to time the regurgitation in diastole. So what would cause this pirate's heart to break? Congenital defects like a bicuspid valve or fused cusp was not in the stars. Being a young pirate, the only calcium buildup was on the planks of his ship, and although he sailed the world, his adventures started in America, where rheumatic fever is no longer an issue. No, this pirate suffered from endocarditis, an infection in his heart from all the dark deeds he had done. Dr. Calypso's ordered blood counts and cultures to confirm the reason for this sick man's heart. A dead man tells no tales. So before our pirate's heart gets to that point, I will simply explain the heart-pounding story of aortic insufficiency. If our pirate's AOV is not fully closing, whether it be from a leaky valve, an enlarged aorta, or soared through the chest, the blood will pull back into the left ventricle, denying the rest of his body the bright red blood needed for getting a little exercise. Going for a nice casual ride. Getting the chores done. Or being an efficient provider for his family when it comes to bringing home the bacon. So naturally, any adventurer would ask the question, where do I go from here? For mild cases of AI, follow-up echoes will be done to evaluate ejection fracture, size of the chambers, and enlargement of ventricle walls known as ventricular hypertrophy. If any of these go beyond normal limits and pirate is symptomatic, repair can be done with leaflet reconstruction or aortic reconstruction. Valve replacement is an option with various devices. But of course, the best booty is preventative care with healthy lifestyle changes. So the next time you're short of breath fighting sea monsters, lightheaded before your first drink, and ankles are swollen without shackles on, remember a dashing pirate and find the nearest witch doctor or echocardiologist, whichever won't own your soul, for a clean bill of health.